When I was first diagnosed, I was quite devastated.
I was very shocked and I couldn't believe what was happening to me.
I was age 16. I was very surprised.
I felt very bewildered.
My father was dying from this condition. His sister had died in her early 40s. His mother had died in her early 40s from this condition. And I was a mother of two very young children, and I was so afraid I wasn't going to see them grow up.
Well, I was in a gym and I was exercising and I had a cardiac arrest. My heart stopped beating. I was taken off to hospital and I was told that I had a genetic condition called hypertrophic cardiomyopathy.
My family very shocked because there was no traces of anybody in the family having a heart condition.
I still have problems coming to terms with how it happened. My family hasn't got any history of illness at all.
If you've just been diagnosed as having a heart condition known as hypertrophic cardiomyopathy, competitive sports like these are now not available to you. It might seem that all is doom and gloom. There is good news. Keep watching. This video has been made in loving memory of my brother Daniel, who died of this condition. The Daniel Yorath Appeal has funded this project in the aim of spreading public awareness of cardiomyopathy, thereby avoiding more needless fatalities. If you or someone close to you have been diagnosed with this condition, then this video is for you. The aim is to explain what it is, what its implications are, how it's diagnosed, if it'll get worse, and what can be done.
Hypertrophic cardiomyopathy is a condition of the heart. It's usually familial and it's characterized by thickening of the heart muscle. It's been recognized for about the last 40 years. Initially, it was felt to be quite rare, largely because the majority of patients with the condition were not recognized. Currently, the best available information would suggest that about 1 in 500 people actually have the gene and are affected by the condition.
But how would you know if you've got it?
Hiya. What's up with you?
Got kicked off the football team.
Oh, what? You're one of their best players.
Yeah, well, it was last season.
Well, what do you mean last season? What's changed? New players.
Oh, I don't know. They all seem faster than me.
Or you're slower.
No.
Or lazy. Perhaps you're not working so hard.
No.
Hey, you haven't been hanging around with that Billy what's-his-face, have you?
What?
Taking drugs, sniffing glue.
No.
What's up then?
Oh, no. Just tired, that's all.
Maybe it's just growing pains. Your age, a lot of things start happening to your body.
Oh, yeah. Well, how comes the school nurse I'm asthmatic then?
What? Yeah, but when?
Well, I don't know. A couple of weeks ago.
Well, why didn't you tell me?
Can't be bothered.
I don't believe it. Asthma? Tired? No, I want a second opinion. I think we'll go and see the doctor.
Oh, no, do we have to?
Come on.
Not all heart conditions start this way. Not all exhibit any symptoms at all. Sometimes it can be too late. What is happening here is that Ricky is suffering breathlessness and fatigue. Often this can continue even when resting.
The initial presentation may occasionally be with sudden death from hypertrophic cardiomyopathy, but overall this is actually not common. And usually the first awareness of the condition are symptoms. They may not be recognized either by the individual or the physician attending, because they often occur in healthy young people, but the initial awareness is usually symptoms of chest pain, breathlessness, awareness of rapid heartbeat or palpitation, or unexplained fainting episodes.
To understand what is happening to the heart, we must first understand how a normal one works.
The heart is simply a mechanical pump with its own electrical system, and it has 4 chambers. The right side of the heart will pump blood, which is blue blood, through the lungs where it picks up oxygen. The oxygenated blood is red. It comes back into the left side of the heart, into the filling chamber of the left side, which is the left atrium, and then into the left ventricle, which is the main pumping chamber, and that pumps the blood around the body, to the brain, the muscles, the liver, the kidneys. And if you think about it, it's actually quite incredible. It does sort of 60, 70 times a minute for 60, 70, 80 years, or whatever the rest of you is good for, it has to do that. And in hypertrophic cardiomyopathy, the muscle is thickened, and the heart, rather than being nice and even in its ejection and relaxation, is actually dynamic. It ejects the blood rapidly with high pressure. The problem isn't getting the blood out of the heart, it's actually getting the blood into the heart. And it's stiff, so it, and then it's stiff getting the blood in. And it's a lot like a weightlifter. He's got the big 19-inch biceps, he can, pick up the back end of a lorry, but he can't actually get a fork in his mouth because the muscle's stiff, it doesn't relax, it's using too much oxygen and glucose for what it's doing. In a normal heart of an average-sized man, the muscle of the heart is about 1 centimeter thick. In hypertrophic cardiomyopathy, the diagnosis is made when the muscle is more than 1.5 centimeters thick. The thickening can be anywhere in the left ventricle. Most commonly, it's seen in the septum, between the left and the right ventricle. But it may occur in the apex, and occasionally it's diffuse, involving all of the segments of the left ventricle. The thickening may be up to 3 to 4 centimeters. An additional problem can occur, that being obstruction. Here, the thickening in the outflow region reduces the ejection of blood. This causes turbulent blood flow, which is recognized as a murmur. The thickening of the heart muscle typically takes place during adolescent growth, and that thickening has usually been completed by early adult life, say age 25. During adult life, symptoms may appear to get worse, and effectively what's happening is not the disease progressing, it's the fact that you cope less and less well with this stiff, dynamic heart muscle. And much like as you get older, you don't have the same exercise capacity when you're 50 as you did when you're 20. So you're coping less well, but the disease is not actually progressing. Abnormal electrical activation of the heart also contributes. In the normal heart, muscle cells are organized properly next to each other, and the heart activates electrically by having the electrical current pass through the muscle cells, and that happens almost simultaneously so that the whole heart can contract. In hypertrophic cardiomyopathy, the muscle cells are disorganized. The alignment of one cell to the next cell can be completely crisscrossed, side to side, side to end. If you think about the electricity having to go through the heart almost all simultaneously, it can't do that when these cells are disorganized because it'll go around in small circuits, short circuits if you will, and this is inherently very electrically unstable.
To secure absolute proof of hypertrophic cardiomyopathy requires a number of tests to be made. The results aren't always conclusive, so a combination of these tests, as opposed to a specific single test, needs to be undertaken. By placing electrodes on a chest, the heart's electrical signal can be measured. This entirely safe test is known as the electrocardiogram, or ECG, and can determine if the heart's electrical signal is abnormal. This abnormality might point to a cell disorganization and muscle thickening. Excessive muscle thickness can be detected by an echocardiogram, commonly referred to as an echo. This is similar to the ultrasound that is used in scanning prenatal babies. An enhancement to the echocardiogram is the Doppler. This can measure the flow of blood into and out of the heart through the use of a colour image. Both of these tests are entirely safe. An exercise test provides an objective assessment of how much a patient can do. During the test, measurements are made of the amount of oxygen breathed in and carbon dioxide breathed out, while the electrocardiogram and blood pressure are monitored continuously. A Holter monitor uses 5 ECG electrodes and a small Walkman-sized tape recorder to monitor the heartbeat over 24 or ideally 48 hours. The recording of different forms of irregular heartbeat may provide an explanation for symptoms of palpitation, lightheadedness or fainting, and may help to identify patients who are at risk of sudden death. As time progresses, we're discovering new information about the condition. A recent discovery is that gene errors or mutations in the makeup of a person's DNA can be identified. DNA is the alphabet or building block for the genetic code, which determines the makeup of the body and an individual's characteristic features. The mutations which have been found to cause hypertrophic cardiomyopathy are like simple spelling mistakes within an entire encyclopedia. Genes are identified from parents. A parent with hypertrophic cardiomyopathy will have a 50% chance of passing the gene mutation onto each of his or her children. In the future, it's likely that knowledge of gene mutation will improve understanding and treatment of the condition.
In 90% of patients, the condition is hereditary. By creating a family tree showing generations of relatives and how they died can reveal the condition's genetic fingerprint.
And your father?
Is William.
Does he have any heart problems?
Yes,
at
he
all?
has a heart problem, yes.
Okay. Do you know what that is?
No.
Okay. And how many brothers and sisters do you have?
We have 4 girls and 3 boys.
Okay. Who's the oldest?
Is Scott.
And does Scott have children?
Has 2 children. One of them died suddenly.
Was that the oldest child who died?
Yes.
Suddenly? How old was he when he died?
15 years.
And can you just
He was-
describe what happened?
He was
exactly?
very fit. He played football and he
Mhm.
just died suddenly
On the football
on
pitch?
the football.
Right. And he'd been fit and well previously,
Yes.
no problems. And he has a younger brother, yeah?
Yes.
Okay. Who comes after Scott?
I'm next.
Next. And do you have children?
I have 2 children, a boy and a girl.
Have they been looked at?
They have, yes.
And are their echoes and ECGs normal?
They're normal.
Okay. Are they fit and well?
Yes.
Okay. Is there any other member of your family that you know of who has died at a young age, either playing sport or has had symptoms of blacking out, having fits, either during an activity like exercise or just resting or sitting in a chair? Anything peculiar?
There have been sudden deaths in the family, yes.
Well, looking at your family tree with this information, it looks as if the gene may well have come from your father's side of the family. And the reason why I say that is because he has one brother who's died suddenly
Yes.
for no apparent reason at the age of 25, and then he has had 2 children who've died suddenly.
Oh, good. See, Annie's done the pedigree.
Yes. So can you tell me, Professor McKenna, why in our family have young people died suddenly and yet my grandfather lived into his
Yes.
70s?
How many people have died at a young age?
7 that I know of.
7.
Yes.
And living on into their late ages, are there quite a few?
Yes.
You know, you all in the family will all have the same gene, and yet it's been expressed in very different ways. So, you know, one person may die suddenly, age 15, grandfather is alive and well, age 78. There must be other genes that modify or influence the main gene that's abnormal. There also must be environmental factors, blood pressure, what kind of exercise in life you lead. These are all other factors, but we know in general that if we look at a family, you will find some people who faint, have all of the factors for adverse risk. Others in the family don't. So simply the fact that there have been a lot of deaths in your family doesn't mean that you're going to die suddenly.
The major question the doctor asks is this individual at risk of sudden death?
Yeah, I think family history is very important in picking up new cases of hypertrophic cardiomyopathy, and we're often the first people to know about a case of a sudden death. It's very important to get good information from the autopsy and to look at the children and brothers or sisters of the patient affected.
All patients, regardless of whether they have symptoms or not, and regardless of how thick the heart is, should undergo assessment in relation to risk of sudden death.
I have a list of 2,500 patients, and I have 2 families that I know have hypertrophic cardiomyopathy. I think if I was looking for new cases, I'd be wondering about any odd cardiac symptoms in children or young adults, particularly chest pain, breathlessness, sudden loss of consciousness, particularly with exercise, would alert me to that.
By assessment with history, exercise test, and the Holter monitor, you can accurately identify the low-risk patient and identify the high-risk patients who should undergo treatment to prevent complications. Symptoms of chest pain, breathlessness, and palpitation may be caused by atrial fibrillation. This is a rapid, irregular rhythm which develops because the atria, or filling chambers of the heart, become enlarged or stretched. When atrial fibrillation develops, there's a risk of blood clots forming, and these may be ejected from the heart and cause a stroke. Treatment with blood thinners or anticoagulants to prevent clots forming and drugs to control the rapid heart rate are important and effective. It is extremely important to assess the patient as to whether there is obstruction or not, because the treatments are different. If there is no obstruction present, treatments are pharmacological with two main classes of drugs, beta blockers and calcium antagonists. Those treatments are only moderately effective. They may work to sort of between 10–50% of improvement, but you certainly don't restore normal exercise capacity, or they're not complete relief of chest pain. In patients who have the obstructive form of the disease, the initial treatments, again, are with drugs. And in general, the drugs work very well with the obstructive form of the disease. The two main drugs are diazepyramide or beta blockers, and both of these will suppress the dynamic contraction of the heart. But if drugs don't work, there's a very good and well-established option of surgery. At surgery, the thickened muscle that bulges into the outflow tract, causing obstruction, can be excised or removed. Recently, an alternative method has been developed. Alcohol is injected via a catheter into the muscle, creating a controlled heart attack, causing the muscle to thin and relieve obstruction. In selected patients, a specialized pacemaker may also reduce obstruction. These treatments are generally effective to reduce symptoms, though there is no evidence they prolong life. For patients with high risk of sudden death, there are two treatments: a drug, amiodarone, or an implantable cardioverter defibrillator. Both of these treatments are effective. An implantable cardioverter defibrillator is slightly larger than a pacemaker and is implanted in the same place as a pacemaker, under the skin in the chest. The defibrillator can recognize abnormal fast rhythms. These may degenerate to abnormal electrical activity or ventricular fibrillation. The device then delivers a small electrical pulse or shock, which restores the normal electrical heartbeat.
The bad news is there's no quick fix. Symptoms may persist and restrictions on lifestyle, including participating in competitive sport, may be necessary. The good news is that for the majority, hypertrophic cardiomyopathy is relatively benign. Most patients can work at their chosen careers, have children, and lead a normal or near-normal lifestyle. It is vital in patient management to assess a patient's risk of sudden death. Patients who are at risk of complications, particularly atrial fibrillation and other arrhythmia, can be accurately identified and effectively treated. The family of affected individuals should undergo diagnostic evaluation. Early diagnosis is important in preventing complications.
Yes, we do have a condition. We may have to change our lifestyle a bit, but overall, we can live a relatively normal lifestyle.
I've never felt healthier. It has been a struggle. I've had various treatments, medication and a pacemaker. I've got a healthy 9-year-old child who doesn't have the condition. Life's looking good.
It is just not the death sentence that many people had led me to believe at the beginning.
Now I wake up in the morning, I know what the day's going to be like. The whole attitude, the whole day is better.